Today we're going to talk about IVF in the digital age and 6 reasons why doctors should care about the internet and social media. Hi, I'm Ron King, CEO of Vanguard Communications. We are an internet, digital, and public relations company for specialty physicians, and we want to address why anyone should have any interest in this topic of digital media. So let's talk first about what digital media is. Everyone, of course, knows the internet. That is, though, just one form of the digital media. That is what the World Wide Web actually rests on. The internet is a connection of computers, and the World Wide Web is a way for people using those computers to look at websites. And, of course, those people require browsers to look at websites on the internet. Let's not forget also, though, we have email and we have social media. And lastly, we have something that's a lot of interest now, a lot of talk, called the Internet of Things. And not all of you may know about that, so let's just look at that for a moment. The Internet of Things is really just a network using the internet, and it networks physical objects that are embedded with electronics, software, sensors, and network connectivity. And two very well-known examples of this are the Nest thermostat, which is a very popular thermostat these days, which can be controlled from the internet by the owner of the home where the Nest thermostat resides. And another one, of course, is the Blu-ray player, which can connect to the internet, and you can watch movies, of course, from the Blu-ray player through the internet. So those are a couple of examples of components of the Internet of Things. It might be surprising to know that of all these media, email is actually the oldest. The internet was invented some 4 years after email was first devised in the mid-60s. And of course, the World Wide Web came along in 1993 with the invention of the Mosaic browser, the first browser. And then following that, the Internet of Things in 1999. And surprisingly, social media is really the newest of these various digital media. It's barely been around for a decade. So that gives you some perspective of the age of various digital media. Reason number one, doctors should care about digital media, is that everyone's online. As you can see here, the world's industrialized countries all have the majority of their citizens with internet access, starting with Iceland, which has the highest density of residents with internet access, and then followed by quite a few others through the United States, Germany, and so on. Even down to Chad, which is one of the world's poorest countries, even has some internet access. But as you can see, more than half of the countries on Earth have roughly half of the people in those countries with internet access. So it's very easy now to get online virtually everywhere in the world. As you can see here, the world is very densely populated with people with internet access. The darker colors represent countries with higher densities of internet users, and the lighter colors are those, of course, with lower densities of internet users. Reason number two, doctors should care about digital media, is that everyone's searching online. There are 3.2 billion internet users worldwide, and they generate 40,000 searches on the Google search engine each second, every day of the year. That ends up being 3.5 billion searches a day and 1.2 trillion searches per year. And that is up by 40% since 2012. In just 3 years, 40% increase in growth in internet searching. Reason number three is that the internet is really an information marketplace. Google tells us that they can look at 30 trillion web pages on the internet. And by the way, that's up from 1 trillion in 2008. And Google, the search engine, searches them all 30 trillion web pages on the internet, a total of 100 billion times per month. An astounding amount of searching that Google is looking at, Google, the search engine, is doing for other searchers on the internet. Reason number four is that social media is ubiquitous. This is a study of just the U.S. citizens using social media, and as you can see, roughly 2/3 of all Americans do use social media, and that is up from 7% in barely a decade. And similarly, this is really more apparent when you look at age groups. 9 out of 10 of young adults are online and using social media. And furthermore, even the older age groups, that is, people 65 and older, are using it at increasing rates, in this case more than 1/3. Fifth reason we should be concerned with internet and digital media is that 80% of internet users have been looking online for health information in the last 12 months. And 84% of college graduates use the internet to gather health information online. And 30% of internet users help loved ones with personal chores, and 70% of those look online for health information. So if you do the math here, you'll see about 1 in 5 internet users are actually looking for health information on behalf of someone else, a loved one. That's reason number 5. Reason number 6, doctors should pay attention to this digital media, is it's what patients do. They look for health information first and healthcare providers second. They go online to look for healthcare information. That leads them further towards the step of looking for healthcare providers. And this is evidenced by the number of searches online every month, which Google can tell us, for various search terms. So even the search term in vitro is searched over 1 million times a month. Misspelled, it is searched 1.2 million times a month. And look at how rarely people look for fertility clinics in the same month. Less than 1/10 as often here in the gray area. And even less, about half of that, they're looking for infertility centers. And even fewer times, they're looking for infertility doctors. So you can see the search terms people are using to look online have more to do about the information of their possible healthcare challenge than it is about the people who can do something about those problems. So healthcare searching is really driving the internet, and it's very clear here. If you were to search a well-optimized IVF practice, this one happens to be in Tennessee in the United States, and if you type the name of that practice into the Google search engine, you'll get a page that shows you quite a few pieces of evidence that they are in many places on the internet. The website, their Facebook page, there's something we call the Google information box, which is a little box that tells all about this IVF practice in short summary. And it's a great way for them to have a nice presence to a lot of people in just one simple search. So this concludes the 6 reasons people should have some interest in learning more about using the digital media in IVF medicine. And I want to say that I do welcome any questions or comments you may have at this address. This is me. This is my photo here. We've been in business since 1994. Healthcare marketing, online and offline, is all we do. We will guarantee growth for any of our clients within year 1 in terms of new patient visits. And lastly, if you're interested in knowing more about this world, please go to Amazon.com and look up my book, The Totally Wired Doctor. I hope this gives you some good reasons to think more about digital media and the practice of IVF medicine, and to think more seriously about how you could use the digital media in your practice.